Good afternoon. I'll provide some highlights to the report you received in your packet. The first thing is we are beginning our new strategic plan for 2019 to 2021, and one of the updates I wanted to give you today is related to better care. We have launched a new technology for reminder calls in our EMR, providing reminder calls and text messaging to the consumers that we serve and support, hoping to improve practices and reduce the number of no-shows that we have for those individuals receiving services. We've also issued an RFP for social recreational services for the intellectually and developmentally disabled as part of the millage here in Jackson. And we have completed one and have a second site visit this week with local CMHs near. One was in CEI and the other one is in Washtenaw, who have 24/7 access and crisis continuum of care services, including crisis residential on site, to assist with our certified community behavioral health clinic planning. Community Mental Health Association of Michigan conference highlights. One of the highlights that we wanted to make sure that you were aware of is the Michigan Inpatient Psychiatric Work Group is working to develop a standardized medical clearance form and algorithm. So for individuals that are seen in the EDs throughout the state, there are different opinions on what medical clearance means when a person is ready to be seen and screened for psychiatric inpatient. And this state work group is working to create a common definition and common expectations related to medical clearance, regardless of the hospital that the individual is at. Substance use disorder rules. LARA, the Licensing and Regulatory Affairs, has come out with recommendations to change the SUD licensing rules. Both the substance use disorder and the CMH systems are concerned about the recommendations. First one would be barriers to medication-assisted treatment. There are limitations to how many patients a doctor can provide medication assistance treatment to. Disruptions in staffing. There are proposed changes that would reduce staff capacity to provide services versus those who currently are able to provide services. And requirements for residential detox, having to have a nurse on call 24 hours a day, 7 days a week, will impact the ability to provide the service and will make access to the treatment even more difficult than it currently is. There's a significant concern about the financial cost and the impact on access and capacity on treatment services with these SUD licensing recommendations. So we have had opportunity to provide feedback to LARA, and decisions will be forthcoming. Mental health education. Since January of 2018, we have presented on the following mental health topics to our communities. We have had 106 participants go through mental health first aid. We've had 133 participants go through youth mental health first aid. 110 participants participate in Safe Talk suicide training. 287 participants go through ACEs, the Adverse Childhood Experience training. 478 participants go through a general education of mental health. We also just recently in the month of November piloted with Jackson up here a law enforcement training. We had recent recruits and cadets go through a training with Jackson Police and provided feedback on what was helpful and what was not helpful. It was basically a foundational type of training for law enforcement. We have made some tweaks based upon their feedback, and we'll be providing that treatment ongoing. Some highlights from Mid-State Health Network, CMHSP separation from the PHP. So we have a CMH in our region, Saginaw CMH, that it will be separating from Mid-State Health Network to participate in the Section 298 pilot. There's a work group that's being developed to work on this. It's time limited, and the completion will be by the time the 298 pilot starts, October 1st of 2019. There's also been a request made for CMH Medicaid authorization data specific to inpatient psychiatric services to develop utilization management guidelines based on assessment scores that are completed for inpatient psychiatric services. The intended outcome is for consistency across the region with an agreed amount of variability and understated variance. So some consistency and equity across the region related to eligibility for inpatient and days approved for inpatient. And that concludes my report.
Thank you, Shannon. Go ahead, Doc.
Going back
Hmm. Mm-hmm.
Yeah.
So I have not seen any of the feedback yet from the MyPad group related to this. There are physicians, hospital systems that are on the MyPad group, so I'm hoping that they'll be able to bring some of that. What I know that we're hoping for is, for example, we may look at medical clearance as the person has had labs completed, we've ruled out any medical condition like a UTI or something for the presentation of the individual in the ED. We're looking to make sure they're not under the influence of any type of illicit drugs or legal activity prior to making any determination of whether or not your presentation really meets inpatient level of care. Other places may only do a BAL, and they worry about the other labs later. And so we're hoping for some guidance, some commonality across the hospital systems on these are the type of things that we're going to at least look for relative to when we're okay to go in and do our screen. We have to ensure that that person is cleared prior to doing the pre-screen for inpatient, and wanting to make sure that whatever those necessary labs might be, that we at least have those available to us when we're making the determination to inpatient. So I don't believe ever the human component would be missing. I think they're trying to look for some commonalities around a BAL level. If a person is under the influence, what is the level that people feel comfortable with that they would be able to still go in and do a comprehensive screen on an individual for inpatient care, knowing that they may have used something in the last 24 hours, for example. Mm-hmm. Mm-hmm.
Thank you very much, Sharon.
Thank you.
Bye-bye. Medical care facility. Sandra. Hi.
Hey. As most of you know, all good things must come to an end. And my last day at Jackson County Medical Care will be the 31st, when we celebrate the achievement of Milestone 4 for Eden. I wanted to share with you this morning the letter that I shared with our team, our families, and residents, and our volunteers, because I think you have the abbreviated version, the very professional one. This one's more heartfelt. And then I'm going to let Destiny do the rest of the report. I just wanted to say goodbye in this way. It is with bittersweet emotions that I pen this letter to all those that I care about, care for, and care with at JCMCF. And I thought I could just breeze right through this. I've been blessed with the best team any leader could hope to have. We have accomplished more than most of our profession could ever dream of, but as with all things, the time of change has come for me and I must step aside. I will be leaving my role as administrator at JCMCF on December 31st of this year. Until then, I will remain in my full leadership role. I'm pleased to announce that the board has chosen Destiny Wilkins to assume my role. I know she will walk in step with all that we stand for and care for at JCMCF, her elders and care partners, as I do. While I'm leaving as administrator, I'm honored to continue as a consultant to Destiny and the DHHS board to ensure a smooth transition and offer support to the team. Please know that my heart will be a constant at JCMCF, and I have been honored to work with you. Continue the great work you do, and I know that you will achieve great things together. So I wanted to say thank you to all of you. Your support's been incredible over the last 9.5 years. So thank you. Destiny? Don't let her.
Sandra.
I was going to run.
Go ahead, John.
Grab my Kleenex and run.
No, you, Sandy, I had the pleasure of being on the board at the time you got hired, and I recall the medical care facility and the trials and tribulations that it was going through, and the confrontational, for lack of a better word, role that, or relationship that the board had with the medical care facility at the time. And
I'm armed.
Together we fought some great fights.
We did.
Both this board and the MCF board, going up to Lansing for one, and
Washington for 2.
and having a conversation in terms of how we're supposed to work together with Lansing and not be in an adversarial role with Lansing. And I don't know if that's actually gotten to where we want it to get, but at least there's acknowledgement that we're the good guys in the process of caring for the indigent and the individuals who need the help, and going beyond that, and offering them the opportunity to have a quality of care that they may not be able to receive in the private sector without the means. And I'm proud to have been a part of that, and proud to have watched you fight so hard for the citizens of the county and the citizens of the community, and to get that message across to the board, and then have that board support back. I think we're a great team, and I'm hopeful and looking forward to Destiny taking the reins and moving forward, but you've already moved to just a good position. Still, obviously, there are always things that we can improve upon.
Yep.
We know that, but again, I think we're in a much better position. You're leaving Jackson County in a much better position than it was when you took the reins initially. Thank you for that.
Whew, thank you. Can I sit down now?
No? Okay. Come on, this is not torture, this is love. Come on, Doc.
Sometimes love is torture.
I'd like to thank you for your work for the years and dedication and so on. And I still remember in one of your reports, the lowest infection rate compared to the hospital and so on, because your innovative aspect of putting the stuff in the nurses' pockets, okay, hand sanitizer so they leave the room and put on, that was a terrific idea, okay, and so on. And to have a lower infection rate than many places, okay, is something really to be proud of. Thank you very much. I've told them at the hospital about this, okay, and so on, but it goes in deaf ears, so.
Well, I also make these little things that clip on that you can pull out and pull back, and you can clip the hand sanitizer on too.
Oh, good.
Okay, and I can, no.
Anybody else? I can go back about 8 years, and I actually was a commissioner that was a thorn to you guys.
Just a wee bit.
Just a little bit. And then Chairman Shallow put me on an ad hoc committee, which involved the medical care facility and the private sector. I think he did that intentionally. But at that point, I learned to appreciate Jackson County and Jackson County's medical care facility. I learned to appreciate what was necessarily necessary to be accomplished and done by the public sector, and how much people needed a medical care facility to exist. So I certainly changed my view, as you know, Sandra, and you and I have had many personal conversations about a lot of different things. You've been wonderful, and obviously my perspective about you and medical care facility completely has changed, and I've been blessed to be an advocate for a few years now. So again, thank you very much.
Thank you.
And I will be coming to your party.
Awesome.
Okay, all
It's
right.
going to be a good one.
All right.
No booze, sorry.
Okay.
That's after.
All right, now you can, I think now you can sit.
Thank you. Thank you,
Destiny.
everyone. I really appreciate your kind words.
Yeah.
Well, I'm not sure how to follow that. So I'm just going to give you the highlights from the report, if that's okay. So under the financial section, our Medicaid rate from last year that had been reduced has now been restored. So that gives us some additional wiggle room for operations, which is very encouraging. Our QMI payment, which is the Quality Measure Initiative payments, have been initiated, and that is a result of our quality measure stars from the CMS 5-star rating. So that's something that's a statewide program that has just recently gone into effect. Under people, we had wage reopeners for M&A, AFSCME 139 and 2098A. All of those have been ratified, the wage proposals, and we are just awaiting the DHHS board approval for those. We did hire a new HR director. Her name is Karen Belair, who started with us late in September and started full-time with us in mid-October while she was after fulfilling her notice elsewhere. So she's jumped right on board, learning our processes and getting to know our care partners as quickly as she can. Last Friday, she actually went around to everybody and offered them an orange to say, "Orange, you glad it's Friday?" So that she's jumping right in. Sandy has shared with you that she'll be retiring on the 31st. So if you'd like to join us for her celebration for all that she's done for JCMCF, we're holding that at 2 p.m. On December 26th in the main dining area. We did have our Halloween celebrations again this year, which were well attended, as they always are, with Vandercook High School, again helping us create our haunted house for our elders and our families, which they absolutely love. Trick-or-treating this year hosted around 300 children, so that's always an exciting day for our elders. We've continued to work with the CARE Collaborative with Henry Ford Allegiance Hospital, and working on improving community continuum of care, reduction of rehospitalizations, and improved access to health information across the continuum of care. So December is going to be chock full of activities for our elders and families to celebrate the holidays together, and then, of course, celebrating Sandy's service and our Milestone 4 accomplishment, which is the highest level of accomplishment you can reach with the Eden Alternative for our efforts in person-directed care. So that's very exciting. In the area of quality, we did drop 1 star overall due to a small number of our QMs being out of line from where we'd like to see them be. So we are working actively on that with our quality assurance process. So we're hoping to be back to where we were at 4 stars here within a quarter or two. We continue to be a 5-star in staffing. Our antipsychotics are still below the state and national averages, and so are our fall rates. Both our care and cost QMs are in good positions, and we achieved slightly more than the 100% Medicare reimbursement rate for next year. So they have a program that if your cost QMs are not in line, that they actually will dock a percentage of what you reimburse from Medicare. So we received just slightly over 100%. Our QAPI plan, so our Quality Assessment and Performance Improvement Plan for 2019 is in process and almost completed, and so is our facility assessment to look at strategic planning for 2019. On December 31st, we will be celebrating Milestone 4 to be able to celebrate with all of our care partners for all the wonderful work that they've done for our elders, to be able to give them as many choices and opportunities to live their life to the fullest that they can. And that is all for now, unless you have any questions for me. Yes?
Doc?
What information system do you use?
For between the hospital and, we use Epic.
Epic?
Yep.
Okay. All right, just checking. Thank
Yep.
you.
Any other questions? Thank you.
Thank
Welcome.
you.
Okay, we're down to number D, DHHS Quarterly Report.
Hello. Zoe wasn't here today, so I'm Bobby Norman. I'm the program manager for the cash assistance at MDHHS, and I'll be delivering her report. The first attachment was the community collaboration, so it is a list of committees that either herself, the other program manager, or myself attend each month. If you have any questions about any of those, I'd be happy to answer them for you. One of the things that Ms. Lyons wanted to talk about today was the JobStar program, and it is continuing to do well. The monthly board meetings, we share success stories with the heads of companies that are involved, and we've recently gotten Mackey to join on in January. They will be part of the cohort that is currently working. United Way has done an excellent job in taking the lead on this project, and we are very appreciative of the leadership they have taken both in the initiative of the work and in the ongoing success. The JobStar Success Coach works, so just a refresher for those of you who might not know what the program is, it works within local companies to assist employees with needed resources such as daycares, transportation, assistance with the needs of elderly parents, school resources, vehicle issues, and other things that would prevent the employee from coming to work or maintaining a job. By having this job coach on site, we're able to hopefully reduce the absenteeism of employees, increase productivity, reduce turnover, and thereby saving money for the companies while also supporting the continued growth and employment of their staff members. The second thing that she wanted to talk about was the Jackson YouthNet. As you may know, over the last 2 years, Jackson County was chosen as a site for a pilot program with the goal of reducing the number of residential placements for at-risk youth. The definition of at-risk youth are children in foster care that are 10 years or older, children involved in the court delinquency system on probation, or children that are involved in the court delinquency system at the youth home. By reducing the number of children that end up in a residential facility where the costs range from anywhere from $100 to $300 per day, and by maintaining them safely in their families and communities, we are able to save local monies. The goal with the overall success would be savings for the county while also providing sustainable programs for the community. There's been a lot of work within our community to determine how to move forward towards this successful action. We are in the final stages of the decision-making regarding what we will be putting in place that will not only bring success to the individual youth, but that will change the system for the long term. The YouthNet team has used surveys with youth on developmental assets, interviews with both professionals who work with these families as well as the families themselves, using the human-centered design and resource mapping to help us get to the best solution. It has taken time, but we are doing innovative work towards a successful end, and a further update will be provided at the next quarter. Jackson County also went live with the Universal Caseload System in August of 2018. At last report, we're in the very early in the new way of doing business, and we're still learning. They're rolling the counties out throughout the state in a uniform sort of manner, so that everybody is going up at a certain time, so the whole state doesn't go up at once. Since we've launched, there's been a number of issues that have been identified at the state level that MDHHS is working on technological fixes for. As we await the implementation of these changes in January of 2019, we continue to work hard with the resources that we have to get each client what they need. That being said, there have been clients voicing frustrations with the new way of doing business. If you have anyone who is having difficulty with getting their needs met, please contact Zoe at 780-7171, and we will determine the issue and get it fixed. We understand that this is a difficult time of the year for many families living in poverty, and we work diligently to help them through it with ease. And the last thing that she wanted to mention was the Child Care Fund update. We continue to monitor our child care funding spending in our new fiscal year. We remain within the budget at this time. While it is early in the year, we are continuously working on ways to ensure that our families have the assistance they need while we remain within our specified budget. We are continuing to recruit foster parents for all ages of children, while we also seek to recruit some of our experienced foster parents to take on the children that are older, between the 10 and 17 years of age, or who have more significant needs, such as behavioral issues, mental health, or physical needs. The YouthNet project noted previously is specifically in place to create community resources that provide families and youth with the support they need, so that when the youth are in foster care and have issues that arise, they are able to remain in the community and out of residential placement. This will save money for the county. That is all I have. Is there any questions?
Thank you very much. Anyone? Appreciate it. Thank you. Number E, MSU Extension 2019 Memorandum of Agreement. Matt?
Good afternoon. The agreement that's in front of you should be fairly self-explanatory. It's just the finalization of our budget process each year, just the agreement of the services that we provide in comparison with what you provide for us. And just like to take the opportunity to thank you again for all the support that you do provide for MSU Extension in the county, and be happy to answer any questions if you have them.
Committee, we have seen this before, as Matt just said. If there isn't any questions, I'll be looking for a motion and support. To send, okay, motion support to send down to the full board. All those in favor, so I'm going to say an aye. Opposed, nay. Thanks, Matt. Just that
Thank you
easy.
again. Appreciate it.
Veterans Affairs. Aha.
Good afternoon.
Hi.
I'm the new face of the Veterans Affairs in Jackson County. Mr. Willihan had retired on the 21st of November, so this is my first month in the office as the official director, which has not come without a few trials and tribulations through some of the supporting agents we have.
Just a few people, just because of a few people here and that, I'm sure most of us up here know your name, but if you give your name, that'd be great.
My name's Philip McCaskey.
Philip McCaskey. Okay. Thank you. Go ahead, Philip.
So since coming on staff, we're in the process of converting all of our files. We have 26 or 28 full filing cabinets of records that we're converting over to electronic version, and in the process of shredding the originals and having them all updated. The other thing is we've started the first phase of applying for a grant from the Michigan Veterans Affairs Agency. They've offered a $5,000 IT grant, which will help us with some of the offsets of the cost of the county for signature pads going into this new electronic version of Veterans Affairs. Also, we're looking at putting in a kiosk, so veterans who come in and we hand them a clipboard and get a paper filing back, so we have to email or fax it to the National Public Records Center. It's all going to be electronic. That's our plan. And also applying for VA healthcare can all be done online, so getting rid of the paper versions of everything we do. Some of the trials that we really come about, I got a phone call last week. The Marine Corps League has announced that they're closing their doors and they will no longer be coming in to be doing any service work in the state of Michigan. They've lost funding through their department, and they're not making on the grant that the state had put forth, so they've elected to close their doors. We're also notified that the Military Order of Purple Heart possibly will be closing in June. So those are some things which will affect some of the service hours that we have within the county. So I'm working right now with the American Legion to try to pick up a few of those hours, and hopefully they'll come through for us on the dates that those other two organizations are there. We still have the Vietnam veterans coming in every Thursday, and we have brought them in a little bit on Friday, but they're moving over to Region 8, which is the west side of the state, is where they need the coverage. So we're in negotiations with the Veterans Committee in the state of Michigan through all the organizations. So that's something to become about here soon, hopefully. And I will tell you that one of the biggest goals, I've been coming into Jackson County for 10 years as the American Legion Service Officer, so I've came to Jackson every Tuesday. It was when the job came open and was asked to apply, it was something that I really look forward to, because Dave Willihan really set the bar high for Veterans Affairs in Jackson. I went to probably 9 or 10 counties throughout my endeavors. None of them were ever run like the Jackson County. So keeping that high standard is one of the biggest goals I have. Is, the Jackson County public is very veteran appreciative and are very helpful, which makes things they move a lot easier when you have the support we have throughout the county and the support of the commissioners too. I thank you. Any questions?
Question, John.
Thank you, Mr. Chair. Philip, congratulations on taking the position. Sounds like they put you right into the thick of it and then made it tough. And I would echo your comments about Dave. I'm over in the Battle Creek area, and they've had some trials and tribulations over there with the Veterans Affairs, and it's been a blessing that we haven't seen those same things here, and what Dave's been able to establish, and hopefully you're able to take the reins and move forward. I have some concerns that you had indicated that the state of Michigan has some grant dollars available that assist in the volunteers and the organizations that assist us. And if we had, I guess, one of the things that we're strong advocates for, particularly we have Representative Leitner here with us, but we have the ability to have that contact with our elected officials and to kind of focus that voice, from the full county and shine some light on those issues. So if we could get kind of an understanding what that dollar amount might be, I know that the state legislature is usually generally very supportive of our veterans and our military affairs. And so if they recognize that the federal government has removed funding and there's a shortcoming, and they may be well aware of it, but something that if you can inform us and we can echo that on to our electeds to make sure that you guys have that assistance, that would be helpful.
Yes, definitely. This, like I said, this all came about, they lost, like the Marine Corps League, they lost their director, then they had a new director. Well, when the new director came in, it was uncovered that there was a financial problem within their organization. But then, with the grant that they get from the Michigan Veterans Affairs Agency, it just was, they can't operate. They just can't cover the payrolls, so it was, yes.
So if we could if we could get a number, if there's some number out there that gives us what it would take to, and it sounds like that organization has its own problems, so ultimately they're going to have to take care of their house. But again, we don't want to lose what had been built up in terms of the volunteers coming in and kind of offsetting some of those pressures that I know that Dave was feeling.
And then the national organization of the Military of Purple Heart has they've disbanded. So they've announced to their local entities that they're no longer a national service organization. So they've closed indirectly altogether.
No, thank you. Again, as Commissioner Williams said, welcome and appreciate it. And if you'd send that information on, that'd be great.
I will.
All right,
Thank
Philip.
you.
All right. Richard, Health Department, Sixth Amendment to the HO service agreement with HFAH.
Yes, good afternoon.
Go ahead, I'm sorry.
So you do have in your packet the kind of standard amendment, if you will, to the Health Officer Service Agreement between Henry Ford Legion's Health and Jackson County. The only changes in this particular agreement would be essentially within the financials that are attached as part of this document in board docs, and that's just the cost of living adjustment that normally takes place each time we renew the agreement. So there are no changes in the original agreement at this point in time. And, what I normally do for the health system is kind of laid out also in the attachment I've included as well. These might get a little tweaked, if you will, in the future as a result of the recruitment effort for my position going forward into 2019, but it won't be anything significant. So I'm asking for your approval to continue the relationship with Henry Ford Legion's Health.
Okay, again, this is one we've done before over the years. From my understanding, this has certainly been a good working relationship, also from a cost standpoint. So if there is anything, I'd be looking for a motion of support. A motion of support? Okay. Oh, sorry, Doc, go ahead.
Your agreement with Allegiance, okay, what is that? What do you do for Allegiance?
Well, in the packet of information, what I try to do with them is to try to integrate effective clinical and community-based services and expand accessibility across the continuum. I really do as much work as I can with them to try to integrate public health services that are available in the community with medical care and in the medical practices.
Okay, are they responsive to your
Yes.
needs and questions?
We've also...
Especially since the change over to Henry Ford. Okay.
Yes, I would say that I think that the switch in terms of the merger with Henry Ford Legion's Health, or Henry Ford Health System, has created a little bit more challenges because they also now have to be responsive and address the issues that One Detroit is bringing forward to them as part of the system. But one of our most recent successes, I consider to be a success, is that within the clinically integrated network, Jackson Health Network quality measures, they have now agreed to add a monitor quality measure, which means that for the first 12 months, they will monitor something before they make an incentive type of quality measure for the human papillomavirus vaccine. Our rates for that are low in the community, and putting in the quality measures will increase emphasis on it for providers. We want to see that vaccination rate improve. So from a cancer prevention perspective, it's what we need to do in the community. That's just one example.
Thank you.
You're welcome.
Okay, thanks. Okay, again, all those in favor, or no, let's do a motion of support. Okay, all those in favor, so saying aye? Aye. Opposed, nay? Thank you. You're still here, Richard.
Thank you.
We're on number H.
Yes, this would be the contract agreement with Relias Limited Liability Corporation. As I've indicated in my probably rather lengthy staff report to you, this is a project and an effort we've been working on for close to 2 years at this point in time. It does support a number of different objectives and goals, if you will, certainly within the High Performance Organization Coordinating Council's work plan and action plan, if you will, but also the Health Department's strategic plan. We've been wanting to put in place a 21st century learning management system based function in the Health Department for quite some time. We have quite a bit of training that our staff need to do, and just keeping track of it all and keeping it updated is a major challenge. So because of also my interactions and contact, if you will, with Henry Ford Legion's Health, I'm very well aware of their community-based learning module system called Net Learning. Henry Ford Health System has one as well. And everybody gets assigned specific required courses to complete on an annual basis, and these systems completely keep track of it. With the one that we've chosen, for instance, we have HIPAA training, we have bloodborne pathogen training, we have chemical hygiene and safety, we have tuberculosis training. All that content is developed and maintained by the vendor. So we don't have to work on our end to research and compile and redo and reconstitute, if you will, the slide presentations that we have. They will do all that for us. They keep track of case law. They make sure if anything changes, it gets incorporated. So we're really excited about that piece of it. The other thing I think that's really important to mention is that all of these learning management systems that are out there now, and there are lots of vendors. We looked at 10 different vendors. The IT department, the HR department helped us sort through them to figure out which ones might be best for us. And we looked at this from the perspective of, okay, well, the health department could be a pilot for an LMS for the county, and if we like it, we can replicate it, we can expand it, and we can make it available on a broader basis across all the county departments. So we're willing to do that, in service to our community. The other thing I was going to mention is that if we develop local content here locally, whether through the health department or eventually kind of on a countywide basis, it can be uploaded in the system. There's no additional charge for it, and then it makes that content available to us as well. We chose Relias because they are health-oriented, health agency-oriented, so their offerings more align with what we need at the health department. But any content that we have, regardless of topic, can be uploaded into a system like this. So we've kind of figured out that this is the way for us to go, and hope that you'll support us in this. We want to try it. We do have the ability to opt out after the first year if we want to. If we don't like it, it's relatively inexpensive. The first year is about $7,500. The second year is $5,000 a year after that. And this is a 5-year term, but like I said, we can opt out of it in any year that we want to. So we have some protection there. So I'm happy to answer any more questions you might have about it.
Questions or comments? And this is a 5-year contract?
Correct.
Okay. Yeah, go ahead.
Actually, just from our county administrator, just is this all in line's recommendation? Okay, that's it. Thank you.
We do have the funds.
Okay, this will be going to the full board. All those, motion and support, please. Motion support. All those in favor, so say an aye. Aye. Opposed, nay. All right, thank you very much.
Thank you very much.
Go ahead with your report.
Monthly report. It's been a busy month of November, if you will. I'll touch on a few things and highlight a few things in my report. As you know, we locally here in Jackson have been working on creating the Jackson Care Hub. Dr. Mike Klinkman, who is a part-time medical director with JHN, prepared a poster for the presentation at the North American Primary Care Research Group Annual Conference in Chicago. And I think what was nice about it, although there's a lot of information packed into a small 8.5 by 11 piece of paper in board docs, it does showcase how we've used participatory design to co-create that community health information hub. And I did attach a poster in there for your information. So we do a lot of good and innovative work here in our community. Also wanted to share with you the trended youth data from the Michigan Profile for Healthy Youth. We attended a meeting with the Intermediate School District, who kind of sponsors and facilitates the completion of these surveys in all 13 school districts in the county. They're done by 7th, 9th, and 11th graders. It is a self-report survey, so there's a certain amount of bias built into them. But some of the more concerning trends that we saw in this data was the increase in the proportion of students who self-reported symptoms of depression in the past year, and the percent who seriously considered attempting suicide and made a plan to do so. That was kind of a rather significant bump up that we're concerned about. Also, the percent of 11th graders who now perceive marijuana use as less risky than they used to. And some of that, I think, is just about all the media coverage and information that's out there about marijuana, both recreational and medicinal. We know that it's not without risk to use these products, and we'll talk about that a little bit later in my report. So the information that I shared with you is going to be shared with the Behavioral Health Action Team, as well as Drug Free Jackson, because there's some information in there about cigarette use, marijuana use, etc. So I attach that for your information. There is now a Network Sustainability Ad Hoc Committee that's meeting. Yes, sir.
When you said that there's an uptick in depression and suicides and so on, that's a good point to recognize early, but is there a plan to deal with that so we don't have later on the suicide rate going up and up and up?
Well, the number one priority of the Behavioral Health Action Team of the Health Improvement Organization Coordinating Council is youth mental health services. And what we're hearing from parents is that they want youth mental health services available to them in school district settings. That's where the kids are. It's a lot more convenient in a lot of respects, for a parent to consent, yes, you can come see my child in the school district, and I'm happy to have you see them there. There's a lot more logistical details associated with trying to do that work, but suffice it to say that we have 2 or 3 organizations in the community now that are providing youth mental health services in some school districts. You may or may not have heard of Project Aware. It was a 3-year funded effort that I think will be ending this year, early next year, if you will, from the Substance Abuse and Mental Health Services Administration. The Intermediate School District obtained the funding, and Project Aware has been working diligently with 4 pilot school districts between Jackson and Hillsdale County to actually increase the availability of mental health services in the schools, and they've done a good job of doing that. We want to continue it. We want to expand it. That's what BHAT will be focusing on.
Thank you.
Yep. As I was saying, the Network Sustainability Ad Hoc Committee meeting kicked off this month of November, and the first meeting of the committee was to review and discuss goals and objectives associated with determining how to sustain the Jackson Collaborative Network efforts going forward, post-state innovation model. We're a SIM community, but that funding will end next year, approximately November. There's about 9.5 FTEs that are funded by SIM, and we need to do some critical thinking now about the network structure that's needed to support continued achievement of those community goals and objectives associated with the state innovation model. So I'm participating in that. That'll be quite a challenge for us. I also included, because I'm not really sure necessarily anybody else has gotten this to you, the marijuana ballot proposal talking points, which was developed by the state of Michigan. We got it at local health departments. I'm not sure how many of you may have seen it, or others in the community receiving the approved ballot proposal. But the talking points were organized by background in food and agriculture impact, public health and marijuana, frequently asked questions, specific marijuana and health detail directly from the CDC. So a lot of the health detail that's direct from the CDC was contained to some extent in the resolution that the Board of Commissioners passed back in October, November, if you will, before the ballot measure. So those didn't go away just because the decision was made to legalize recreational marijuana use. Those health concerns will continue to exist. I would point out that, and I think you guys probably know this, 15% of the 10% tax on recreational marijuana will come to counties. And I'd ask you to think about what would be the best utilization of those funds. I think from my perspective, there's a big need, and I would advocate and recommend some health education efforts in the community be ramped up relative to marijuana. So when that becomes available, which probably won't be for a couple years down the road, I'd encourage you to think seriously about that. You have assets and resources, the health department that can help you with it. Under health education, health promotion, we and the Jackson District Library were selected as Community Learning Partner Grant recipients, if you will. And this grant, which was duly funded by Henry Ford Legion's Health and the Jackson Community Foundation, will enable us to step out of the box, let's put it that way. We're always trying to find new ways of engaging with the community authentically. And I think what we mean by that is really getting out into the communities, to sit down with people and talk with them about how we best provide services to them. It's one thing to do it kind of centrally from Jackson here from the Human Service Building, but that's not really getting to the people with the opinions and the knowledge and the preferences, if you will. So the two focus areas that we have submitted an application for is Teen Pregnancy Prevention Initiatives Teen Advisory Council, and that one is to involve teens even more than we already have and helping them help us design services that best meet their needs. And also, the Jackson District Library wants to engage with citizens at the grassroots level in a rural area of the county, and we are thinking about Springport Township at this point in time. We attended a kickoff event on Monday, December 3rd. That went well. And the amounts requested between the two proposals is $22,000. So we're looking forward to working with the district library in this. You've probably heard me talk previously about the 410s project at the health department over the summer. That was a success. It was positive. It was probably most positive for the clients that we serve in the WIC program. It was a bit more demanding for staff, though. Their feedback identified difficulties in managing their personal, family, and professional lives. And work demands associated with the schedule. So recognizing that, we sat back down with staff and said, okay, how could we do this differently, but at least preserve some of the gains that we made? And so we decided to do a Tuesday early and late night clinic, 1 day a week, every Tuesday from 7:30 to 6 p.m. And we think that that'll preserve the gains for us to do that going forward. And we're going to run that through June of 2019 and then evaluate again. Under Personal and Preventive Health Services, Flu Fit, this is an effort that we were approached from Henry Ford Legion's Health. They wanted us to consider partnering with the American Cancer Society and the Henry Ford Cancer Institute to implement the Flu Fit concept, which this is basically someone comes to the health department for a flu shot, and we're able to talk with them also and share information on how they can get a colorectal cancer test done as well. It's not done at the health department. We just give them the information and the kit, and they go from there. So we did implement that program. I don't have any results to share with you yet, but it's another way of helping people get some preventive services under their belt, and it's important for people at 50 and over. I believe they get mailed to both. Yep. Under environmental health, Mike, you're probably aware of this as well. We did get a request by Advanced Resource Recovery to sample the leachate collected from the closed McGill landfill for PFAS-related compounds. This is all related to AAR is picking up our leachate. They're taking it to the Detroit wastewater treatment plant. The wastewater treatment plant has to test their influent. So that's what this is about. I don't know where the testing process is at or if it's been done yet. I haven't seen any results, but obviously there could be some implications depending upon the leachate sample results. I'm not expecting us to find any sort of a high level of PFAS in leachate from the closed landfill, but I also don't know exactly what's in it. So we'll keep you informed on that. House Bills 5752 and 5753 We've previously talked about these a little bit in the past. These are bills that would basically establish a statewide sanitary code, and while we're not opposed to the statewide sanitary code, there's always details that need to be worked out. We're a little concerned about the funding of the additional work that will come with it, and so we're monitoring that closely. We expect it is going to move in the lame duck session in the legislature, and there was a couple committee meetings last week at the local government committee level. We didn't see anything happen from those yet, but we're monitoring it pretty closely. And I did include Don Hayduck's opinions regarding the whole set of bills and the attached review in board docs. So if you have any questions about any of that content, I'm happy to answer them for you, and that would pretty much constitute my report for you today.
The statewide sanitary code, that applies to what?
That would apply to septic systems in rural areas of the community.
Okay, all right, thank you.
Richard, appreciate your time and a thorough report. Thank you very much.
Thank you.
Okay, we're down to J, Finance, the Medical Care Facility MOE resolution. Mike? Were you winning at that card game? No, finance. MOE, the transfer money. Yeah, current situation.
Really, any questions on it?
No. Okay.
Oh,
I mean-
give me a hard time.
Give you a hard time. Sure, why not? Okay, we're going to be sending this to full board. All those in favor, signal. Motion and support again. That's helping you guys out. All those in favor, someone saying aye. Opposed, nay. Thank you very much. Thanks, Mike. Julie, got to sit here and listen to all this. Region 2 AAA report.
Good afternoon, and thanks for having me today. I'm Julie Weatherby from the Area Agency on Aging. We sent a report a couple months ago. It was from October 1st of 17 through September 30th of 18. We had some conflicts, so we couldn't be here in October, I think it was, when we were to be here. But just to review that report quickly, during that time frame, we served 599 My Choice waiver clients from Jackson County, 72 care management clients, and helped assist 38 Jackson County residents transfer from nursing home to their home of choice. And also during that time, we received over 5,000 calls from Jackson County residents, and referrals were made to Jackson County agencies in about 2,800 of those instances. And through the Medicare and Medicaid Assistance Program, which is our program where we help folks select a Part D program for their health insurance through Medicare, we served 2,300 folks. In fact, we just finished Medicare Part D season. There's an open enrollment period where people have an opportunity to review their medications and find out the best health insurance plan for them for their prescription services primarily, and that ended last Friday, in fact. So we had a lot of folks that we served through that program, both in our office in Brooklyn, and then the Jackson Department on Aging also sees people in their offices. For fiscal year 19, our budget is, from the state and federal budget, is about the same for Region 2 and our contractors. We did receive an increase in our funding to expand our medication management program, which has been popular since we started it. Last year was the first year. There's been a slight overall increase in the Older Americans Act funding. However, the state continues to release funding to us on a quarter-by-quarter basis, and that's because that's how the federal government is releasing funds to the state. So we're still at the mercy of, the federal budget in the case of those funds. The Village of Brooklyn was awarded the Community for a Lifetime designation, which we organized. It's a designation that comes through the Aging and Adult Services Agency, and it's so that we can all evaluate communities to make sure that it's livable for all ages. We did receive that designation for the Village of Brooklyn. In fact, we have a ceremony tonight at 6 p.m. at the Village Council offices in Brooklyn to receive that commendation, and we have someone from ASA, Dan Dozma, as well as Amy Tripp, who is a commissioner for the Aging Services at the state level, will be there for the presentation. We're planning to start working soon on another place in our three-county area. Somerset Center has expressed interest, as well as Lenawee County. So we're researching those places for that option, those options.
Could you give me a little background on, in terms of, is this something that's, I assume there's a specific formula for this, but is it something that each county is able to put in for and designate one county, or are there criteria that have to be met? How many counties how many communities for all are there? If you have that information.
It's part of our area plan that we are required through Aging and Adult Services Agency at the state level to work on this designation.
Okay.
And we can choose or work with any place. Like, I know we did have a meeting, I think Nicole was involved in that, for the city of Jackson. And then we just have to, usually we find it easiest to work with one village, city, or township at a time to get through the designation. But it comes with a survey. We go through a survey that talks about transportation services, all the services that are in an area, to see how they, what the status is now, and then make recommendations as things change throughout planning for a city or a township or a village. So, recognizing, for example, in Brooklyn, we don't have a robust transportation system out there, but we do, that's one of the concerns that came up, and then we have a committee that will continue to meet on that.
Thank you, Mr. Chair.
Another event that's happening this week is on Thursday from 2:30 to 4:30 is our open house out at the agency. So I invite you all to come out. We have one every year. We like to see anybody that would like to come out and visit our facility, meet with staff, meet with us, meet with some of our providers are also there. And, yep. Mr. Williams has his invitation right there, so we invite you all to come out, and it's informal, but just a time to chat and hear about what we do out at the Area Agency on Aging. Another event we have happening right now is, we call it Holidays at Home, and we do a donation drive to get gifts for some of our most neediest participants, and we take collections for those gifts because we cannot use state or federal funding for that. This year we've raised enough money to buy gifts for approximately 56 of our participants, and then whatever funds we have left over from that effort, we put in our unmet needs funds that we can use throughout the year for requests that come to us that we can't pay for, again, with state or federal dollars. So that is happening. If anybody wants to donate, please get in touch with me. We're still working on that. Another thing I just wanted to say quickly was to thank Carl for his service on our board. I asked my assistant Greg today, I said, how long has Carl been on the board at Region 2 Area Agency on Aging? And Greg thought it was since January of 2013, which is 5 years. I don't know if that's incorrect or not, but that's the records he had. So, Carl brings a lot of advocacy forward for our seniors and our disabled adults in the 3 counties. And I know, there's new appointments happening here and in the other 2 counties as well, and I don't know how that's going to go, but I just wanted to give Carl a shout out because he is someone that I and the other board members count on for his expertise in this area. Any questions for me today?
The donations that you talked about, what are they used for again?
For Christmas gifts for some of our neediest participants, and then the rest goes for an unmet needs fund. So we have various requests throughout the year, like we had one just recently, somebody had lost their winter coat and they needed a winter coat, so we used the funds to buy a winter coat. We've had things for maybe covering a propane bill because somebody got behind so they could continue to heat their house. I know of a one that came through for a cord of wood because they had a fireplace or a burner in their home that they needed a cord of wood so that they could stay warm. All sorts of things like that, a piece of equipment, just something that we can't pay for with our other funds.
So if you want to donate, you got a number or an address or something? Tell me how you do that.
You can do that through me. I can get you a business card before I leave here, and you can give me a call, and I can tell you, you can go on our website and do it online, or you can mail a check to the agency.
Okay, thank you.
That it?
That's it.
Well, I appreciate your kind words, and sounds like the doc might be sending a check. I thought I heard in my right ear, could be wrong, but I think maybe the administrator is going to be sending a check too.
Okay.
So I would like that to be put on public record. Administrator Michael Overton, helping out the aging population with their unmet needs. I really appreciate that, Mike. Other than that, I will be at your event as well. So it sounds like I'm going to be at several of them. And this is a sign of an inside thing, but John, what we talked about earlier?
Yeah.
Yep, you're right. Anyway, thank you very much. I appreciate it.
Thank you.
All right, bye. Okay.
I move we pay the claims, Mr.
Second.
Chairman. Aye.
Opposed, nay? Department of Aging. I don't know, we'll be chairing.